So looking at that center of that gluteal fold, so right in here, I'm just gonna take that bladder point at 36 and just go straight P to A there. 30 to 40s are probably fine to go ahead and use in this one. Like I could probably almost use a 30 for, or a 40 for her. Now, I'm just gonna suck it up. Do 3 of my fingers is gonna be equal to that for hers. So 3 and 3 here, find that popliteal fossa, that middle of the crease there. 3 and 3 should put me somewhere right over here. And I'm not gonna use the whole 50, I'm just gonna kind of go down a little bit. How's that feel? Yeah. Now I definitely need some of these.
There you go.
Thank you. Okay. Now I typically end up doing bladder 40 first because I use that as a marker for the other ones. But you don't have to, it's easy to do 40, 39, and 38. So I'll go right in the center there. And that's heavy angulation, but again, I see a little bit of a superficial vein there, so I'm not gonna go right into that one. I'm gonna cheat it, probably a little bit above it. Nice little angulation there. Heavier is a little better, so if you're guessing, I wouldn't go more straight up to that 90-degree spot. I'd kind of bring it down more to your 0 if you're questioning what you're doing on that one and not sure. Bladder 39, gonna go to the lateral aspect here. So, and this is one too, when you're doing it, it's probably beneficial, depending on the patient, to have them bend their knee up first and kind of really palpate where they're at, where their hamstring tendons are at. Then you can mark them if you want to, know where they're at. Some people, you can kind of palpate them pretty easily there. But if I go right on the lateral side there, I know, again, I want to avoid that. So I'm actually gonna sneak it right on the lateral side of that one. Go P to A there. And I go 1 chun proximal to that, which is probably gonna be about a half a chun, if a little bit less. There's a little vein right there. So I'm gonna go ahead and sneak that one just a little bit more medial because of how it runs. How's that feel, right? Okay. What kind of sensation you have with that one?
A little burn.
Okay. Sometimes you can get a little burn if you get in the vein. You also get a little burn if you're around the nerve area too. Or just, it can just be sensitive. So one feeling doesn't always indicate exactly what it should be. Okay.
Is that 38 you just did?
Yes. Kidney 10. So I'm gonna come over to that medial side, same thing, level of popliteal fossa there. I'm gonna try and find that tendon right there. I'm gonna go and sneak that one in between them and do that in nice medial to lateral direction and back towards that joint line. And the last one's your RC point. Go 50 for this one. Any tendons over in this area?
Yeah.
Okay. So I'm just gonna kind of pinch that area, pull it out. Just kind of do a nice fast in and out there. And I can pick it up, move directions. Now the thing is, when you're changing directions with the needle, you almost have to take it all the way out. Once you take it all the way out, then you can kind of change and re-angulate that needle a little bit more. If you don't do that and you want to take it like 20 of the 50 out, you're going to go in that same tone you already created. So you've got to be pretty good. And according to some of the studies, I think Hong did a couple studies regarding that. The speed of the insertions actually got a lot of the trigger point stuff going on there too. So it doesn't have to be a slow or a really quick retraction, but it's got to be a really good, fast insertion into that one to get a good trigger point response out of it. He had better luck with that, I guess. So then if, say you got a couple on there, I can add one up here and one down here if I wanted to. You're a lot more free in this area. There's not as much stuff to worry about because all that's deep to and next to the femur anyway. So a lot more freedom to kind of go P to A here. It's not much to worry about. All right, now if I wanted to adapt this for some specific hamstring stuff, add like some attachment dysfunction that people may have, I'm gonna grab a sharp container real quick. I would go ahead and find the ish tube and go ahead and bracket that and put a needle right in there and do some pecking right over that area. Okay, some people that have that attachment stuff, you definitely want to recreate that healing process. Usually not a lot of blood flow to those areas anyway. and I would leave it in there and stim it too. So I would put that one there and maybe match it up with something here if they had some issues here, or even on the lateral side, depending on where the rest of their hamstring was. But that's, I think you're going to get more luck out of this one and probably see more patients have that issue than you will just the perineural stuff, is actually attacking that site there and then going down along where you have the rest of the muscle bellies out there. I think that'll be good for those hamstring patients that you get. All right. Good there. Back at it to press the tissue so I'm more accurate with my needle that I want to be at. And there, I'm on bone right there. And I just kind of peck and move it around where I want to be at. And that's a broad area. You can easily put 2 needles in there if you wanted to. Put one on the superior aspect and actually put one a little bit inferior medial, that one too, depending on where they have their spot. So that's exactly what I would do with that one now.
And you leave those in there too after you do it?
Mm-hmm. Absolutely, leave them and stim them. A lot of times those attachment things, you want to get that blood flow in there, and then again, you want to actually create all that stuff with electricity.
Makes sense.
So yeah.